Well, there's nothing worse than being in pain, and if you are, Atlantic Coast Pain Specialist here in Conway is here to help you. Dr. Klein, thank you so much for having us today.
Thank you for being here.
Absolutely. Now, you have a rich history in pain management. Talk to us a little bit about your background.
Well, I've been practicing anesthesiology for almost 20 years. I focused primarily in hospital-based setting where I was chief of anesthesiology at Carolinas Hospital, and then I transferred over to focus primarily on pain management at Florence Neurosurgery and Spine, and I was there for 3 years before building and opening my own practice here in Conway. I have a lot of roots in this area. I went to undergraduate at Coastal Carolina University, and so I'm still very tied to the university, so I love it here.
Very nice. This is a beautiful facility.
Thank you so much.
I understand you guys use state-of-the-art equipment. Talk to us about some of the machines that you have here.
Okay, we have fluoroscopy, which is real-time x-ray, so we can actually see exactly where we're placing a needle in real time and guide it in and then inject dye onto a nerve root so we know that we're in the exact spot that's causing the pain to treat it effectively. We also have radiofrequency ablation, which can actually burn nerves to stop the innervation of pain from a joint to the brain, and that can last for up to 2 years. Patients can be almost pain-free.
It's amazing.
We also do spinal cord stimulation, which is a way of effectively treating someone who's had chronic pain but has not been effectively treated by nerve blocks or surgery or any other modalities. It's a way of blocking the perception of pain to the brain. Yeah.
Wow, that's so interesting. So how many of these treatments, is it kind of a one treatment and you're done, or how does that work for patients? I'm sure it varies from patient to patient depending on what they're experiencing.
It does.
But what can they expect?
Usually what we try to do is 2 treatments. If the patient responds great to just one injection, then there's no reason to have another. But the goal is to inject steroid onto an area to hopefully decrease inflammation and allow the body to heal itself. Now typically we'll do a series of 3 injections, and if the patient is improving, then we'll continue to do them every 3 months for a year until the pain goes away or it gets worsened to where they're not experiencing any improvement. We also utilize physical therapy as one of our modality treatments, and then if we do not experience relief, like after 2 injections, physical therapy, they're not improving, then we do seek surgical consultation, and we do have great ties to some fantastic neurosurgeons in the community.
That's great. I love that you guys are not, you're non-narcotic, so you're really trying to find the source of the problem and fix it. You really want to make this problem better for the patient.
Exactly.
So that's amazing.
Exactly. Now we do provide some narcotic analgesia if needed in the interim to try to help out.
That's wonderful, but you're not prolonging that use and really trying to just fix the problem, which is amazing. You guys have some great examples of some of the stuff that you do on the website. Guys, you see it right here on the screen. Be sure to check that out. Would you like to add anything else, Doctor?
Also, we do kyphoplasty. I didn't mention that. If someone has a broken bone in their back that can be very painful for a prolonged period of time and it doesn't heal correctly, we can actually go in with 2 cannulas and inject cement to stabilize this bone, and the pain goes away almost instantaneously.
That's amazing. Oh my goodness.
Yep.
You have all kinds of different treatments here. Guys, be sure to check them out. Give them a call today. Check them out online. They'll be happy to help you and happy to help you with your pain.